Welcome to the Mwale Medical and Technology City video podcast. In this video podcast, Dr. Maurice Siminyu, the consultant surgeon at Hamptons Hospital, is speaking to Dr. Daniel Olaya and Dr. Raphael Olaya, commonly known as the O-Twins, about why the hospital was set up in the rural area.
We started this hospital in 2018. That's when we opened the doors to this facility for patients to start coming in. And the idea was that our vision was that we wanted to provide quality healthcare which is available and accessible to the people in the rural community. Most health facilities that are of this standard are normally based in the large cities of this country. And so the idea of having this facility in a rural setup was to let the common mwananchi who lives in the rural places be able to access such facilities. This was also in keeping with the national policy of devolution. Devolution in this country came in 2010, and the idea of devolution was to enable different counties to manage their affairs at their level, not at the federal or national level. So we also adopted that concept and said if devolution means decentralizing services to the rural areas, then that also is one of the concepts that we are going to go by. And so we set up this facility to provide quality health care to the rural community, which is affordable and accessible. Why Hamptons Hospital? We are here because we focused on a condition that was seeing so many of our local population having to go elsewhere to seek medical attention, especially cancer. And we actually set up this as a cancer center to be able to enable our locals to access cancer treatment. As we all know, cancer treatment can only be effective if diagnosed early and the management is started early. There are different modes of cancer management, surgical intervention being one, hormonal therapy, chemotherapy, and radiotherapy, but the diagnosis must be first done early before we can expect a good prognosis. As a facility in the rural areas, we are able to organize for camps so that patients can come for screening. Screening is such an important aspect in the management of cancer that we are able to pick early cases when normal people come for those medical camps. And so we have been encouraging wananchi to come for screening, and we have our laboratory services here, our pharmacy services available, and also our other diagnostic departments available.